Hello again, it's Dr. Bob Browner for Partnership for Healthy Lincoln. We're now going to talk about solutions for here in Lincoln, partially based on what's already happening. First things start, of course, with individual efforts. Things that you could do for yourself in order to reverse the obesity epidemic. Number one is go for a walk. If there's one thing that we could do that would have the biggest effect on health and healthcare costs, it was simply getting people to go for a walk a day. Most people will need to have some idea of exactly how much to walk and really shooting for at least 10,000 steps per day. This comes from studies of the Amish who have a very low rate of overweight and obesity, and most of them are very active because, of course, they don't drive cars, and they get about 10,000 steps per day. This leads to one of the interventions that are often used where people have pedometers and have some way of continuously tracking how well they're doing. Another thing you can do as an individual is simply drink less soda and other sugar-sweetened beverages. This includes the fruit drinks, energy drinks, sports drinks, things like that. Of course, eat more fruits and vegetables. Nothing new there, something your grandmother may have told you. Fourth, watch less television. And lastly, encourage more breastfeeding. We've also been using some handouts across the community. This 5-4-3-2-1-GO poster created by Teach a Kid to Fish and adapted by a similar handout from Clock in Chicago basically gives very simple, easy to understand messages that are being given out in our schools and our physicians' offices currently. Another thing we can do is develop our own data to know how bad the obesity epidemic is here and where it's at its worst so we can target our resources. We can also set targets for ourselves over time, and of course we'd like to try and decrease the percentage of elementary school kids who are obese from 15.9% in 2010 to hopefully 2015 less than 15%. Another important effort is coordinated school health. Right now we have a Healthy School Builders program active in 30 of our elementary schools. This is a program organized nationally by Alliance for a Healthier Generation and locally by Shannon Vogler. We've had a lot of examples in elementary schools. Both Friedgerman and Campbell, for example, have been highlighted on the national website for some of their efforts. Here's an example of some of the news releases that were presented nationally from both Campbell and Friedgerman Elementary. We'd like to, of course, reproduce this in other schools and get as many schools signed up to this as possible. Another encouraging thing lately is that the Nebraska Department of Education has adopted a coordinated school health policy which really echoes a lot of the same things in the Healthy School Builder program. This basically makes it part of the school's job to have a wellness committee, to have a district-level person who coordinates it, and also individual school-level efforts to coordinate this as well. Unfortunately, like a lot of policies, though, this is unfunded and has no requirements at this time. One of our efforts here in town is to actually create a funded position for Lincoln Public Schools for a school wellness coordinator. Partnership for Healthy Lincoln is committed to providing 40% of the funds needed to create this position. We're currently working with other Lincoln organizations to raise the remaining funds. We're also working on raising funds for individual school-based efforts similar to what's going on in Campbell and Friedgerman Elementary to help them with their progress. Streets Alive is another thing we'd like to promote. This basically tries to close the knowing-doing gap, where a lot of people know what they need to do to be healthy, but they don't actually get practice at it. There's a common saying in public health that it's easier to act your way into a new way of thinking rather than to think your way to a new way of acting. So we'd actually like to start this here in Lincoln. Our current goal is to start this in the fall of 2011. It would include the Antelope Valley Project, street closures going near some of our elementary schools and other landmarks near downtown. Successful examples of where this has already been done is in Fargo, Moorhead, Atlanta, Madison, Portland, and many other communities across the country. It illustrates the vital role of city streets, bike and walking paths as part of being physically active and also being used as transportation. Some people actually call this the Open Streets Project as a way to actually open the streets up to something besides just cars. Some pictures from Fargo where they did this. Here's downtown Fargo. People out with their bikes, on their rollerblades, with their dogs, people jogging, and it usually is a very fun and active community event. Another thing we'd like to focus a lot of our time and efforts on is employee wellness programs. The evidence behind this is getting much more solid. A Health Affairs article last year, which was a medical analysis of all previous studies done, has shown that medical cost savings of $3 for every dollar spent and also reduced absenteeism costs of almost $3 for every dollar spent for employee wellness programs. So not only does it lower the health care costs, it increases the productivity of employees. The good thing is we have a lot of numerous examples here in town where this is already being done. Lincoln has an organization called WorkWell, which is currently working with many employers. We have testimonials from several business leaders here in town and also a testimony from Governor Heineman about the state's progress of this effort.